With the release of Daredevil, Born Again, the time is right to make my triumphant return to Beat 'em Up Anatomy, yo. Alongside Professor Matt Murdock, we'll study the human body under, shall we say, extreme stress. Buckle up, interns. Disney's depiction of the devil of Hell's Kitchen is nothing short of brutal. Thankfully, a cut-resistant supersuit is a surefire way to avoid the lacerations and puncture wounds that we might expect when crashing through a glass window. But before we go any further, let it be known, any physical trauma depicted in this video is dramatized and fictional, and is carefully contextualized within an educational lesson on human anatomy and injury, in accordance with YouTube's own community guidelines. Got it, YouTube assessor? Thank you. All right, Professor Murdock, have at him. Throwing knife to face from point blank range. Courtesy, episode 1 bad guy, Bullseye. When I slow the footage, it looks like the blade made contact with the victim's forehead, also known as the frontal bone, which is considered the strongest bone in the face. While there are facial structures far more prone to penetration, like the eye socket, where several small weak bones converge around the eye, this is Bullseye we're talking about. And with Daredevil delivering a barrage of heavy blows, he may soon have reason to worry about his own facial bone structure. A strong uppercut can easily fracture the mandible or the jawbone, while a good left cross puts the zygoma, or cheekbone, and possibly the maxilla, the bone between the cheek, nose, and upper lip, at risk. Without any inherent superpowers and a pullover cotton mask for protection, Bullseye will definitely want to avoid more of those. And guest Professor Murdock will want to avoid more of those as well. A throwing knife puncture wound somewhere between the left shoulder and chest, with the lungs, subclavian blood vessels, and brachial plexus all in the neighborhood. When stabbed, it's generally recommended to leave the knife in place until medical professionals assess and treat the wound, as removing it exacerbates damage or increases bleeding. Subtle foreshadowing, anyone? But even stuck like a pig, Daredevil delivers a spinning back kick to Poindexter with easily sufficient force to fracture some more of his facial anatomy. What's a nasal arch to a pair of stompers like these? The two continue to duke it out as Professor Murdock desperately tries to limit Bullseye from throwing more objects at innocent patrons of the bar. Thrown with enough force, a pool ball can definitely be deadly. The impact can easily fracture the skull, causing severe head trauma, potentially leading to cerebral contusions, bruising of the brain tissue, and hemorrhaging or bleeding within the skull. This trauma can also cause diffuse axonal injury, tearing of nerve fibers that transmit signals between brain cells, resulting in permanent cognitive impairment, memory loss, or altered states of consciousness. Remember what I said about leaving the blade in? Seems our hero is following that advice to the T. I just wish maybe he'd do a little more dodging. This collection of knives were likely intended for Daredevil's heart, which lies behind the sternum in the thoracic cavity, slightly offset to the left side of the chest. Sure, it's protected by the rib cage, but if only one blade slips through, Matt's in trouble. A puncture wound to the heart can be catastrophic, as it can lead to rapid blood loss, cardiac tamponade, fluid accumulating in the sac that surrounds the heart, or even cardiac arrest. The heart's thin walls and constant motion make it particularly susceptible to damage from a penetrating injury, and the resulting bleeding can be difficult to control. And don't even get me started on these knives stuck in Matt's abdomen, where there's no bony protection for the vulnerable organs, including the intestines, the liver, the spleen, and the rectum, all contained within the peritoneal cavity. Judging by how firmly those blades are stuck in Professor Murdoch's gut, a conservative estimate may be 2 to 3 inches of penetration, which indicates a good chance that his peritoneum has a hole or two in it. This is the thin protective membrane lining the abdominal cavity that protects and supports abdominal organs and aids in immune function and waste removal. Matt may have anywhere between 1.5 to 2 inches of abdominal wall muscle. When the peritoneum is punctured, it can lead to infection, peritonitis, and inflammation. But worse yet, if the organs it contains sustain penetrating damage, the intestines contain food at various stages of digestion. Poop, if you're picking up what I'm putting down. And poopy peritoneum, even just a little bit, spells sepsis and a bad day at the office in doctor speak. And don't be fooled by the cool superhero leap. Once the adrenaline and rage wear off, Matt will require a trip to the ER or wherever the hell vigilantes go to get patched up for stitches, antibiotics, and a thorough assessment of internal organ function at the very least. If at this point Bullseye has sustained a fracture somewhere in his facial structure, further punches can cause it to propagate, leading to increased weakening of the bones. At the very least, I'd expect a broken nose since the nasal bones are fragile, generally more exposed than other facial structures, and therefore more vulnerable. The old taste of your own medicine technique. The thing about a knife to the back is that depending on the proximity of the wound to the spinal cord, the risk of nerve damage increases, which can result in numbness, tingling, weakness, or even paralysis. The impact may also cause damage to the surrounding tissues, leading to spinal cord injury or irritation. Combined with all the blunt force head trauma that Bullseye has sustained up until this point, no wonder he started to seem faint. Unfortunately for him, Professor Murdoch, eager to continue our lesson, is showing no signs of letting up. So we're 1, 2, 3, 4 for the roof stories up, and Bullseye falls basically unconscious towards the New York concrete below. You may be surprised to learn that falling from height unconscious may be advantageous due to reduced muscle tension, which reduces the likelihood of an awkward landing. Unless, of course, one lands like a pancake and their head slams directly into the concrete. That particular clip may be a little too brutal for YouTube, but you'll have no trouble finding it on your own. One thing is clear though, after losing his best friend Foggy to a targeted attack, we are not dealing with the same Matt Murdoch.
Where'd he go?
Listen, man, I'm visually impaired. I'd love to help.
And neither are these crooked cops. If only they knew that this version of Daredevil is angry enough to cross some lines. Nothing Professor Murdoch isn't used to. A series of blows to the abdomen, torso, and mid-back, as we might expect from a group of attackers on a fallen victim. Now, in a jumping attack like this, the rib cage really earns its living, if you know what I mean. Wouldn't be surprised to find a fracture or two were we to put Matt under an x-ray machine. But there's no time for that. After his run-in with Bullseye, a couple broken ribs won't even slow him down against a couple of normies.
Go ahead.
He's a lawyer.
Don't do it. No, don't do this. Don't do this. You don't want to do this.
Well, interns, I'm sure you know what comes next. Jesus. The hinge point, a marvel of biology. You'll find this form of articulation at the knees, and in this particular case, the elbows. Elbows up, Canada, elbows up. Hinge joints are designed to move in a specific direction, and as such, allow for movement in only one plane of motion. We've got flexion, bending, and extension, straightening. That's it. When the elbow is forced to extend beyond its maximum range of 180 degrees, the medial and lateral collateral ligaments, which provide stability to the joint, can stretch or even tear. The medial epicondyle, where the flexor tendons attach, can also be at risk of avulsion fractures, where the head of the humerus cracks clean off. And let's not forget the annular ligament, which holds the head of the radius in place, can also suffer from severe strain or even rupture. Safe to say, Mr. Crooked Cop is now in a world of hurt and won't be wielding that firearm for at least 6 to 8 weeks, if not longer. That is, if he even makes it out of this apartment. Even with compromised ligaments at the elbow joint, neither the wrist nor the shoulder or wrist are capable of rotating in this manner. As Professor Murdoch rotates under the opponent's arm, he forces the wrist into hyperextension and supination, stressing the radiocarpal ligaments, the scapholunate ligament, and the TFCC. This creates instability, making it difficult for the opponent to maintain balance and allowing him to guide their head into the table, which may now be complicit in aggravated assault. Now, a blunt force impact to the temple region can be particularly severe due to the thin skull bones and proximity to critical brain structures, such as the temporal lobe. Unfortunately for Mr. Crooked Cop, the temple region is also home to important blood vessels, including the middle meningeal artery. A significant impact can lead to life-threatening injuries, including epidural and subdural hematomas, temporal lobe damage, and increased intracranial pressure. This is why in movies, a hit to the temple is often depicted as a knockout blow or a fatal injury. Yeah, in my experience as a beat-em-up surgeon here on YouTube, these are the eyes of a man who is ready to go the extra mile, as it were. Here we have another, maybe I won't finish the whole clip moment. Professor Murdoch sends his would-be assailant barreling headfirst into the hardwood floor. We can tell from the trajectory that his head will be the first thing to make contact with the ground, followed immediately by his shoulder, driving his cervical spine into extreme lateral flexion, if you know what I'm saying. The cervical spine is particularly vulnerable to injury in situations where the neck is bent or twisted beyond its normal range of motion. And this is easily enough force to cause a broken neck or cervical spine fracture or dislocation, or damage to the spinal cord or surrounding soft tissues. Immediate loss of consciousness as his body flops to the floor. Not a guaranteed deletion, but not the greatest sign. By the way, a spinal cord injury doesn't need to be fatal to change someone's life forever. A spinal cord that has sustained catastrophic damage can no longer transmit nerve impulses effectively below the level of the injury, which is what occurs when a person becomes paralyzed. It's worth noting that either a temple impact or cervical spine injury could have devastating long-term consequences. The potential for brain damage, coupled with the possibility of paralysis or other spinal cord injuries, makes this a particularly uncertain scenario. All facts of which our guest, Professor Murdoch, is painfully aware. For those of you who haven't seen the follow-up episode, my lips are sealed. So for those of you who don't know, I do a lot of Warhammer 40K content on this channel. And one of my patients this week gave me a really pleasant surprise as a thank you after I had performed surgery on him. So he did this character for me, this figure from the Salamander chapter in Warhammer 40K. And everybody's always asking me what my favorite chapter is, and I guess it's now decided. So this is going to become part of my stage content, or one of my assets that'll go on my desk here, or on my shelf, to oversee all my future videos. Thank you very much. That was a very, very thoughtful gift. I appreciate it. I hope you enjoyed my triumphant return to Beat 'em Up Anatomy. Thanks for joining me in this lesson about human anatomy with guest professor Matt Murdoch. If you found this video informative and you want to see more like it, don't forget to subscribe and hit that notification bell for more lessons on health, human anatomy, and injury prevention. And for sneak peeks of my video, consider becoming a member of the channel as well. If you think that this message is worthwhile, consider sharing the video as well. We're working towards a goal of 1 million subs, and we can't do it without you, so let's make it happen together. And of course, don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury, or its sister channel, Human at Home, where we show you how to be healthy in the place where you live. Otherwise, as always, that's been a word from Dr. Chris Raynor, not your everyday ortho, where we see one, do one, teach one.